about what is HIV. Uh, First of all, HIV, we will discuss what is this HIV. HIV is about the virus. Okay? HIV is a virus. It is a human immunodeficiency virus. Human immunodeficiency virus, which means that this virus is only found in the human beings, not in the animals. People have got the wrong conception. We will talk about that later. HIV is it is found only in humans. And then why it is saying that immunodeficiency? Because once the virus enters your body, it is going to affect your immune system. They will destroy your immune system. Okay? So that is the reason why we are saying human immunodeficiency, and then the next one is the virus, HIV. So human immunodeficiency virus. This is, always keep in mind, HIV means it is a virus. And this virus will be in your blood. They will stay in your blood, not in any other places, okay? And then this, once it gets infected with it gets into your blood, it will eat up your immune system. And then in the immune system, we have a cell which is called as the white blood cells. And in the white blood cells, another type of cells which fights against the bacteria, against the, all those kinds of diseases, that immune system, here we have a different a type of cells called CD4 cells. And that CD4 cells protects the body from the foreign invaders. Foreign invaders means different diseases that is, trying to attack our body. At that time, the CD4 cells will protect us from that. So see, our body, once the immune system becomes weak, we will get all types of diseases. So this virus is, they stay in the blood. That is why we have to be very careful when we talk about this blood, when we touch the blood of another person. If you touch with your naked hands, with cut marks and all, and that person happens to be an HIV infected person, then there is a chances, okay, to get infected. And then we will discuss the 4 roots of HIV, okay? But the 4 roots of HIV, number 1, it is the true unprotected sex, okay? That is number 1. Number 2 is exchange of disinfected syringes that we find mainly among the IDUs, that is the drug users, okay? Injecting drug users we find among them. The third one is through the mother to the child. Infected mother without treatment, if she keeps on, going with the life without treatment, then the child will get infected. That is another. That is why, especially when it comes to the pregnant woman, okay, when a woman gets married and gets pregnant, they should always get treated so that the child will be safe. Even if the mother is infected also, the child, a negative child, a HIV negative child can be born. So this is also something we have to keep in mind, because when we talk about the if it is in the licensed blood bank, okay, you will get the blood which is in